Welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be exploring the Community Reports feature on hhdw.org. So what is a community? A community generally refers to a group of people who share something in common, whether it's a geographic location, shared interests, or common characteristics. And understanding health at the community level gives us the ability to identify groups that are at a higher risk for certain negative health outcomes. The Community Reports feature on hhdw.org is a convenient tool that allows users to see health indicators from multiple data sources viewed through the lens of a single community. On hhdw.org, you can find this feature in the toolbar at the top of the website. Currently, we have 3 communities available to explore. So we have our 4 major counties, we have sexual or gender minority, and we have race ethnicity. And here you can see the options that are available for each community. HHDW worked closely with the Hawaii State Department of Health to select measures that cover a range of important health issues. We ended up with 2 different sets of indicators: chronic disease and health risk. There are 22 measures included in the chronic disease indicators, and they cover topics like asthma, heart disease, and diabetes. In the 27 measures included in the health risk indicators, you'll find data on topics such as substance use, healthcare access, and physical activity. And you might notice that a couple of the topic areas are represented in both sets, and that's just because they play a role in both chronic disease and health risk. These indicators come from 3 different data sources, which I just want to briefly introduce or review. The first is the Behavioral Risk Factor Surveillance System, or BRFSS. This is an annual telephone survey of approximately 400,000 adults, including about 7,800 from Hawaii. So this survey covers issues on health status, health-related risk behaviors, chronic conditions, and use of preventive services. Next is the Pregnancy Risk Assessment Monitoring System, or PRAMS, and this is a written or telephone survey of about 1,400 Hawaii residents with a recent birth. It asks about experiences, attitudes, and behaviors before and during pregnancy and shortly after delivery. And then last, we have the Youth Risk Behavior Survey, or YRBS. So this survey takes place every other year and involves about 12,000 public school students in Hawaii in grades 6 to 12. It focuses on the health risk behaviors that contribute to the leading causes of death and disability among youth and young adults. And I really wanted to review these just to show you that these community reports are really able to offer valuable insight into the majority of our residents. Okay, so let's go back to the website. When you click on the Community Reports button, you'll be taken to a page that looks like this. So this is the race ethnicity report for our Japanese residents. You can see at the top that you're able to choose the community that you want, and below that, choose the member of the selected community to display. Below that is where you can choose between chronic disease or health risk indicators. And here you can see we're looking at health risk indicators. So let's walk through this report, and I'll show it again when we do the demo. But the first column is where you can see the list of, in this case, health risk indicators. The reports are based on the 3 most recent years of data for each measure. And if you hover over that information icon, you can see the definition of the indicator, so you know exactly what the data is measuring. Next, you'll see the point estimate for the community member you selected, in this case, Japanese race ethnicity. Next will be the 95% confidence interval for the estimate. And in the 4th column, you'll see one of 3 icons that help you quickly evaluate how that part of the community compares to the value for the state. And then in the last column, you'll see the state value. This is what the 3 different icons look like for making that comparison to the state. If it's a green smiley face, it means the community is performing better than the state overall. In this case, when I say community, I mean the member of the community that you chose. So in this case, Japanese. So a green smiley face means that the community is performing better than the state overall and that the difference is statistically significant. A blue neutral face means the values are about the same. There's no statistical difference between them. And a red frowny face indicates the community is doing statistically worse than the state overall. Let's go back to our report and take a closer look at one of the indicators. So, for example, let's look at current e-cigarette use among adults. If you click on that link, you will be taken to the summary report for that measure. So this report includes charts and a map that show you the data broken out by all three communities: race, ethnicity, county, and sexual or gender minority. Below this, you'll see information about why the measure is important and the definition of the indicator, the data source, and notes on how the measure is calculated. Again, we'll take a closer look at one of these during the demo. But I did want to show you that there are other options for reports. So if you see at the top of the summary report, there's a light purple box with several options. The first is data views. And so in addition to the summary report, you could also see the data just for one of the communities. So if you're interested just in county or just race ethnicity, you can generate a report that focuses on that. Or you can also choose a complete report, which contains everything that the summary report does, but also gives you data tables and a little additional information about the statistics. The next option is for more information, and by choosing important facts in the dropdown, you'll be taken to a page that only shows the indicator definition, how the measure is calculated, using the numerator and denominator, and why it's important. So all of that supporting information, but there's no actual data on this page. So this just gives you the important information around the measure that you're looking at. The last option will show you a list of relevant health topics. In this case, you can link to the asthma respiratory health topic or the tobacco health topic. And we won't be talking about health topics today, but I do want to let you know it's there because it's a really helpful feature. You can get to this module on hhdw.org by selecting it from the top navigation bar. And I just want to show you quickly what's available. There's 20 different health topics. And for each of these, you get some basic public health information and a section where you can explore what data we have around the topic on both HHDW and our sister site, Hawaii Health Matters. If you're interested, check out our YouTube channel because we have done a coffee break on the health topics module. Last, I wanted to be sure you take note of the options to easily save, print, or share your report. Here you can see the buttons that allow you to email, print, or share on social media. So let's go ahead and get to our demo. Here we are on the homepage for hhdw.org. For those of you who aren't as familiar with the site, there's really three basic ways to search the data: the health topics data sources and community reports, which we're going to focus on today. But I do also want to show you there's a quick link to our sister site, Hawaii Health Matters. For those of you who know the site, know you can just get down to business right over here. And then there's also some additional information, links to videos. And then here's our news and announcements. Okay, but we are interested in the community reports. So when you click on that, the default report is for the Native Hawaiian race ethnicity. But you can see it's very easy to change if you were interested in county, race ethnicity, or sexual or gender minority. You can choose that here. We'll take a look at county, and then you have the option to choose which member of that community. So let's take a look at Kauai County. Okay. Below this is where you choose between the chronic disease or health risk indicators. Let's take a look quickly at just at what data is available. So there's a lot of information. There's asthma and breastfeeding. There's some cancer screening, heart disease, diabetes, there's tobacco use, physical activity, and BMI. So you can see these are the chronic disease indicators, and they cover a wide range of topics. Just to show you what the health risk indicators look like, here we can see substance use, and again, BMI, healthcare access, mental health. There's some injury and violence and physical activity, social support, and again, tobacco use. So there's a very wide range of information in these. And as I mentioned, you can really easily analyze the data because of this easy to use icon. So here, again, we're seeing, for example, binge drinking among adults. And if we were to hover over the information icon, it gives you the exact definition. Here is the point estimate for Kauai County, the confidence interval, and we can see that the value for Kauai is similar to the state overall. In fact, it's exactly the same. So there's no statistical difference there. But if we wanted to look and see, okay, so having a personal doctor is something that is less likely in Kauai than the state overall, which doesn't surprise most of us. So let's take a closer look at one of these indicators, the summary report that I talked about. So here's the summary report. You can see the data by race, ethnicity here, and you can hover over the chart to get data values. Then we see the data by county. So this is the nice map that ranks the 4 counties and color codes them. And then last, we have the sexual and gender minority. Then below that is this additional information to help, why is this indicator important? The definition, which is the same thing we saw when we hovered over that information icon. The data source is the behavioral risk factor surveillance system, and this can be used as a suggested citation if you want to share this data in a report or anything. And then some more details on how the measure is calculated, specifically the numerator and denominator. Okay, I'm going to go back up to the top. So this is the summary report that you get as a default, but I mentioned that there are other reports. So say we were really interested in county. If we click the county data view, now what we'll see is this map that we saw in the summary report, but additionally, it gives us a data chart and a data table. And this, of course, can be exported to Excel if you want to run your own work on it. But it gives you, again, the point estimate, the confidence interval, the count, average annual estimated population, and a measure of statistical stability. The other thing that's different about this report from the summary report, it has all of this same stuff, how the measure is calculated, but it also includes more detail about the data. So here you can see there's some information about statistical stability, the survey sample, confidence intervals. And then at the bottom, you see these health topic pages related to the indicator that you're looking at. That is what one of the specific reports look like, and you can do that by race, ethnicity, or sexual gender minority. The complete report, as I mentioned, it just has everything. So it's a slightly different order, but you can see that in addition to the chart by race, ethnicity, you're getting the data table. And then by county, you get the map and the chart and the data table. And then for sexual and gender minority, you get the chart and the data table. This also gives you additional information about statistical stability and confidence intervals. I do want to just show you real quick an example of what our health topics look like. So let's just look at the alcohol health topic. What this is going to show you, it's going to give you some background information, what's important, what is known, who's at risk. And then over on this side, on the right, it's going to give you links to all of the data that we have available in HHDW.org or HawaiiHealthMatters.org that relate to this topic area. And then there's some information about other data sources. So this is a great place to start if you're working with a new topic area. And again, I mentioned we have our coffee break webinar, and then there's also a brief overview. Okay, but let's go back to the community reports. So again, the default here is Native Hawaiian, and you can do a very quick assessment of issues that face the Native Hawaiian population in the state. I also wanted to point out our action icons here so you can print or email or save this report. So just to show you, let's take a look at the sexual or gender minority report. In this case, the default is no. So perhaps we want to look at the community that does identify as a sexual or gender minority. And again, here we can see those results. So these are the chronic disease indicators. And we can do a quick overall assessment or look more in depth. Now let's give you some time for some hands-on work. Take a few minutes to explore the community reports and answer the following questions. The first question asks, how does Maui County compare to the state for the prevalence of adults with high blood pressure? We're going to go to our community reports. We know we're interested in county. We're interested in Maui County. And I'm going to guess that prevalence of high blood pressure is going to be in one of the chronic disease indicators. So we'll just look down here, and here we go. So we can see that actually the Maui County is doing statistically better than the state overall. It has a lower prevalence of adults with high blood pressure. So you can see the point estimate here and the state value here. Okay, the next question asks, which race ethnicity has the lowest rate of adults meeting physical activity guidelines? So this question is asking about race ethnicity, and you could go through here and look at each race ethnicity, or this is asking about meeting guidelines for physical activity. If you click on this, it'll take you to that summary report, which will show you the data broken out by all three communities. So we can see here that it looks like our Chinese residents have the lowest rate of meeting physical activity guidelines. Okay, the last question says, looking at the chronic disease indicators, for how many indicators do sexual or gender minority residents fare worse than the state overall? So let's go back to our homepage for community reports. In this case, we want to look at sexual or gender minority, and we are interested in those that identify yes. And you can pretty much just count 1, 2, 3, 4, 5, 6, 7. I'm counting the frowny faces. 8, 9, 10, 11, 12. So 12 of the chronic disease indicators show that our sexual and gender minority residents are doing worse than the state. And then the question, just to bring it home, was how many in the health risk indicators? We can see here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. So you can very much use these community reports to identify health disparities within different communities in the state. So thank you again for joining us. Let me put on the answers. And I wanted to invite you to join us in September for our next coffee break webinar. So on September 2nd at 11, we'll be getting back to basics with hawaiihealthmatters.org. So this will be a nice overview of the site and its functions. It's a perfect introduction if you're new to Hawaii Health Matters, or a good refresher for returning users. If you have any questions, please contact us at profiles@hhdw.org. Thank you and enjoy the rest of your day.